From the campus of the University of Nebraska at Omaha. Consider This, a program of issues and information behind today's news.
And the assumption that if you get sick, that we're going to have a hospital bed for you is a false assumption. We can fill. Lincoln can fill. Omaha can fill. Grand Island can fill. All of our hospitals can fill up. And then you could be sick with COVID-19 outside of an emergency department, and we may not have capacity. That's really the main message, at least from my perspective.
Hi everyone, I'm Kathy Wyatt. Welcome to this week's edition of Consider This. Our topic, COVID-19 and Nebraska hospitals. We have two guests joining us via Zoom today. Corey Shaw, Executive Vice President and Chief Operating Officer at Nebraska Medicine, and Andy Hale. Andy is the Vice President of Advocacy for the Nebraska Hospital Association. Andy, first of all, welcome.
Thank you, Kathy. It's great to be here. Thanks for having me.
You bet. Let's start off with the numbers, Andy, in terms of the time of this taping, recording. Where were we with numbers?
Well, right now, 29% of our beds are available. There's 1,200 beds across the state that are available. Our ICU capacity is at 21%, so there's 555 beds available for ICU, and ventilators are at 69%, and that's 828. So those numbers look good on paper, but in reality, it's a disturbing tale.
So I have to ask you, what is the first thing you think about when you wake up in the morning and the last thing you think about before you go to sleep at night?
It really has to do with hospital capacity and whether or not someone who needs the care that they need come to our facility and we can't take them. And as it was a great intro, it has nothing to do with really bed space. It has to do with availability. And right now, we're full. We're full across the state. You hear people make reference to maybe opening some office spaces in your hotel or maybe a convention center down the road. We could do that. We could put up a field hospital, but we don't have the staff to do it. And so that is a big issue, especially in our rural parts of the state. So instance, if you had to go to a hospital, maybe 20 miles down the road and it's full, now where are you going to go? You're looking at maybe 80 to 100 miles. And so the situation is exasperated in the rural parts of the state. And we look at, it's car accident patients, it's heart attacks, it's strokes. And we know with those individuals, every second count. And so it is a scary thought to think that someone cannot get the care they need.
Wow. Tell us about the Nebraska Hospital Association.
We represent nearly all hospitals across the state, and we work as the unified voice for the association. And so we've been around since 1927. We do advocacy, we do data for our hospitals, we do quality, marketing, leadership, and provide financial support as well. And so we're kind of a one-stop do-all and support the hospitals in many ways.
And a lot of hospitals at that. We're going to go ahead and put up another graphic for our viewers. Talk about your members, Andy.
Right now we have 94 hospitals, and so as you can see, those are throughout the state. And one number where we're very unique across the country are our critical access hospitals. We have 64. Those are our smaller hospitals in the rural parts of our state, and so those have less than 25 beds. They're about, per definition of rural, they're about 30 miles apart from each other, or have to be to meet that statute. And so if you look at the map, we have hospitals across the state, but take a look at the middle of the state and you can see there's a large gap. And so when we talk about this pandemic and talk about, shifting patients from one hospital to another, it's not an easy task.
Yes, and what is your role specifically? How do you fit into all of this?
I am the Vice President of Advocacy, so I advocate on policy issues that impact Nebraska hospitals. One of my roles is to serve as a liaison between our members and our policymakers. So whether it's at the federal level with Congress or CMS or other agencies, or whether at the state level here with Nebraska Medicaid, and it includes working with the governor and his staff as well.
Yeah, no easy task under the best of circumstances. Andy, what were you thinking and how were you strategizing as we headed into this pandemic?
Well, my main job, and really the main job of the association, was to get what our members need and to get what our hospitals need. And in the beginning of this, it was PPE and ventilators. And so we worked with the state to get those individuals, our hospitals, those certain things. We still have issues with testing, and we'll be distributing the vaccine once it comes out. But right now, our main issue is just staffing and making sure that we have the staffing they need, and to make sure our members are getting their needs met when they do contact the state officials. It's simple as returning an email or a phone call to make sure we work to do that to make sure those all get connected.
Okay. This is not a political issue, yet it seems to have somehow turned into one in some ways. What does that mean for the Nebraska Hospital Association and the work that you guys are doing?
A lot more work. Unfortunately, as you said, it has turned political, and it doesn't need to be. You take a look at mask wearing. I think we missed an opportunity as a state and as a country to come together. I was hoping it'd be something very similar to after 9/11, where everyone kind of gathered and came together. You're hearing things once the election was over on November 3rd, that COVID would just go away. And obviously that's not the case. We are at the worst of the pandemic right now in Nebraska as we tape this, and it is a very serious issue. And it's very disheartening because I understand people don't want to give up liberties, but we've given up liberties to wear seatbelts. We've given up liberties to not smoke indoors. And so wearing a mask should not be so different. And it's very impactful that it's become so political.
You know, Andy, amidst all those challenges, there have to have been some positives that have come out of this. I've talked with folks in the past about the collaborative efforts, especially in an association your size. You have all those different members who may be coming together in a way now that they hadn't done before. Talk about maybe some of the good that has happened as a result of something so bad.
Wow, it really is. Our hospitals, we're very fortunate here in Nebraska that we had a good relationship to begin with. And there's a lot of sharing and a lot of information that gets transferred back and forth. But to see this really taken to a whole new level, we had some hospitals that have been struggling early on with PPE, and a hospital maybe 80 miles down the road would hop in their car and drive directly to that facility and deliver what they need, or sharing of staff, or just information. I'll tell you, the biggest thing is the collaboration with the small hospitals as well as the big hospitals, just about lessons learned. It seems like each individual hospital has been a hotspot, but not at all at the same time. And so they've called upon our other members to sit down and talk about what you did well, where are some things you could have done better or learned from. And it's great to share that experience. It doesn't make it so anxious when those hospitals and those areas become hot spots.
Andy, how do you see getting from point A to point B? I mean, we are at a very, very difficult time right now. Stress levels are high, anxiety is high. How do you see getting from here to where it is that you would hope to be at some point, and that is to have this behind us? But how do we get there?
You know, a vaccine is on the horizon, but I don't think it is going to come tomorrow. And what we need to do right now is wear a mask. The governor talks about the 3 C's: close quarters, confinement, crowded spaces. We need to reemphasize those. And it's not just here in Omaha or Lincoln. It has to be throughout the state. Uh, Everyone needs to be wearing a mask. Everyone needs to be social distancing. Everyone needs to really reconsider if they need to be at large gatherings right now. It is the only way we're going to get this behind us. And, you know, no one wants another shutdown and an economic shutdown. And unfortunately, I think that is on our horizon if we do not heed this warning right now, because things are looking like they're going to get really bad.
Yeah. As we kind of close out this portion of the interview, Andy, just final thoughts from you that you'd like to share with our viewers statewide in terms of the association, your members, people banding together. You've talked about wearing masks. Anything that maybe hasn't been covered in the media that you'd like to get out there now as a final thought?
Well, I'll just tell you, I think a lot of people think, especially in the rural parts of our state, that this isn't going to impact them, this isn't going to affect them. And we know the virus doesn't care if you're a Republican or a Democrat, if you're a moderate or liberal or conservative, whether you're in good health or not, or young or old. This virus will impact everyone. And we just need to take it seriously and need to do those things. Our hospitals are always here for you. We're here 24/7, but it's a scary thought to think if you or a loved one would have to come to our facility and couldn't get the care that you need because we are already full, we are at capacity. It is just a scary thought to think that. And so just think that it could happen to you at any time or happen to a loved one. And please, let's do the right thing now so we can get through the holidays and get past this. And then a vaccine will hopefully finish the job and we can move on from here.
Thank you. Talking with Andy Hale from the Nebraska Hospital Association, COVID-19, and of course our hospitals. We're going to talk with Corey Shaw from Nebraska Medicine in about a minute, but I want to put up a graphic. Andy, just in case folks want to learn more about you guys, and thank you so much for sharing your time and expertise and your stories today. Andy, again, with the Nebraska Hospital Association, that website is nebraskahospitals.org, or you can call them at 402-742-8140. Let's continue now by drilling down into the day-to-day operations of the largest hospital in the state, Nebraska Medicine. Here with their story is Corey Shaw. Corey is the Executive Vice President and Chief Operating Officer. Welcome to you.
Thanks to be here.
Hey, I want to begin by having you, for those people who have not been to Nebraska Medicine, and even those who have, paint a picture of it.
Well, so Nebraska Medicine really is Nebraska's academic health system. So we operate 2 hospitals here in the Omaha Metro, Nebraska Medical Center here at the main campus, Bellevue Medical Center in near Bellevue, and then a network of clinics across the metro area, and also in really across greater Nebraska, including sites in Lincoln and Grand Island. It's the site for UNMC's health professionals to generally get most of their training, clinical training. And obviously a place where we do the majority of clinical research for UNMC and its faculty.
Okay, and pre-COVID-19, how would you explain the day-to-day operations?
Well, busy. One thing that we have, and I think it's just similar to really the rest of Nebraska, is a mindset about we can do anything and certainly want to be here to support the needs of Nebraskans and keep them regionally and locally when they have clinical problems. We're here to provide those. And so really a full service academic health system providing care for patients in our neighborhoods, really across the state, and then in some instances from literally around the world. And it's something we're very proud to be able to do.
Corey, as news of the pandemic came down the pike, what types of conversations was the leadership team having?
Well, we really probably had 3 areas of focus. Number one, and early on, and a little maybe different than the rest of the healthcare providers in the state and really maybe nationally, is working with the federal government in their mission to repatriate U.S. citizens from around the world, primarily China and cruise ships in Southeast Asia, back to the United States safely. Make sure that they were able to get home, quarantine as necessary, and then move on. And we played a large role both directly in hosting patients here in Nebraska at Camp Ashland and on our main campus. then also supporting the logistics to have those citizens come back to the country and go to a variety of places around the country. Secondly, spending quite a bit of time with local and state public health officials and our colleagues at other health systems across the state, preparing them for the unknown in terms of the impact of the pandemic on our citizens and ultimately our health systems. And then thirdly, focusing internally on refreshing our pandemic plan. The last time we had a pandemic plan that we executed was back in 2009 with the H1N1 virus, which was not nearly as pervasive in terms of its impact, but focusing on preparing our health system, using lessons learned there and then what we were gathering in terms of information as we observed and in some instances experienced directly based upon our role with the federal government, what was most likely to happen with the COVID pandemic.
Considering the significance of this, what is important for our viewers to know about the contingency plan that you had in place?
Well, I think first off, really literally hundreds of clinicians, corporate support staff, leaders working together to do the best we could to forecast what was likely to happen. And it's really a multi-layered plan, and one that I think most every other health system, both regionally and around the country, developed. And number one, the priority was the safety of our workforce and our patients. We want to make sure that anything that we do or what we're going to do was going to make sure that we provided the absolute safest environment, recognizing that we didn't know everything at the time about the impact of the virus. Number two is preserving access to citizens to the services that Nebraska Medicine at our various sites provides, both uniquely that others can't, and then also just to support and continue to provide the other types of care that everybody can and play our part in doing that. And then lastly, really supporting the other health systems around the state, making sure that what we understood and learned or were learning at the time from our collaboration with the federal government, that we could share that knowledge with clinics, nursing homes, hospitals, you name it, around the state, so that we were as best prepared as we could be. And I think, frankly, when you look at the track record of what our health systems around the state, not just Nebraska Medicine, has done in terms of managing and supporting our communities, really from the very beginning, nothing but a really remarkable track record in that regard. Okay.
And did that plan, as you were talking, I mean, this is a health issue that has become political. Talk about what the role of government should be in all of this, Corey. I mean, again, you've got some folks who recognize it as health, others who are calling it political. How does all of that affect you then?
Well, I mean, two things can be true at the same time, right? It's a public health crisis. There's just no two ways about it. And I don't think anyone would argue, given the pervasive impact that it's having on our community, our state, and really our country. And I think we all acknowledged it was election year. There were strong opinions about how best to proceed. And the reality was, and keep in mind, when we first started talking about this, we talked about it as the novel coronavirus, which meant that it was new. And we really didn't have a good sense as to how best to approach this from a public health policy, from an economic policy, and from a health system operations standpoint. We've done our best, I think, and have done a great job collectively in terms of working with local and state government, acknowledging that there's trade-off decisions that have to be made. And I think looking back, and it's always easy to sort of be a Monday morning quarterback or in football season, but to recognize that there's some things I'm sure that we all would acknowledge maybe we would have done a little differently had we known now then. But I think the fact of the matter is this is a really important moment for us to ensure that the health systems, the public health entities really across the state, and the local and state government are working very closely together to make sure that we understand our resources, the limitations of those resources and the demands on them, and ensure that we're making good policy decisions in order to protect all Nebraskans at a moment when we're probably under more threat collectively in our communities than we've ever been, or at least for 100 years since the last pandemic, for sure.
Yeah, medical professionals. We opened the program with Dr. Daniel Johnson, and he recently posted, and we're going to put the graphic up for our viewers. I mean, we're really at a place now, Corey, where some of these medical professionals are almost pleading, begging the public to wear masks, to social distance. how bad are things really that you have folks like Dr. Johnson, in any way that he can, trying to communicate this message to get people to understand the significance?
Yeah, so let me give you a couple numbers that maybe will help your viewers sort of internalize what we're dealing with. So today, right now, there are 940 patients that are COVID positive in a hospital bed in the state of Nebraska. A year ago at this time, those beds would have been empty. At the same time, there's well over 1,000 healthcare professionals, doctors, nurses, respiratory therapists, dentists, medical assistants, care techs, you name it, who are currently unable to work because they're at home, either because they themselves are positive or they live with someone in their quarantine and have been exposed. And so when you take the combination of those two variables, 900 additional patients in hospital beds, we've not necessarily expanded the number of hospital beds, and we're dealing with a situation where we have as much as 1,000 fewer health professionals across the state. You can understand the duress that our healthcare professionals that are healthy and working are under. Because in addition to the 900 COVID patients that we're dealing with across the state, we're still dealing with the same number of patients that have cancer, heart and vascular disease that requires hospitalization, stroke. Unfortunately, trauma in the community is actually up a little bit. And so all of that burden continues. So really the COVID patient population is incremental to what we historically have dealt with. And so if you think about it, it's almost as though we've had to, as a state, build another 2 Nebraska Medical Center hospitals someplace in the state to house the incremental patients that are being cared for at this moment.
Corey, can you kind of drill down a little bit? Maybe one story in particular comes to mind, and briefly walk us from start to finish with that individual, because I think we're viewers at home and we're watching and we're thinking, well, that's not going to happen to me. Well, it could happen to somebody that you know, or so give us a case in point that really drives this home.
Yeah, I think maybe there's 2 examples that I would give. One is a COVID patient, and then the other is to keep in mind that right now about 3/4 of the patients that are in a hospital bed that need admission every day are non-COVID. So let's just take a COVID patient. Right now, we have established, in partnership with supporting this for our entire state, a transfer center that's responsible for helping us find a bed for COVID patients. Because right now, as we've said, and we've heard from others, we're full. Everybody is full. Sometimes it takes as many as 8 phone calls. And so that COVID patient's lying in a hospital or in an emergency room someplace in the state of Nebraska, needs to be admitted to a hospital, and there isn't a bed for them. And sometimes hours go by looking for a bed and there aren't any. And sometimes that patient stays right where they're at and maybe unfortunately doesn't get the care that they need. So that's the COVID example. The other example that's happening as we speak right now, because we've already begun statewide to delay needed surgical procedures, is let's just take an example of a 48-year-old farmer or an electrician who needs a spinal fusion because he or she has radiating pain down both arms, renders them unable to work. Right now, we're not doing those surgical cases because they need a hospital bed, and there aren't beds for those patients to be in. We've made a decision collectively in partnership with the state government to suspend those surgical cases. That individual is not going to get better anytime soon, not going to be able to go back to work. And while their life isn't threatened as of right now, certainly their livelihood is. And you can imagine the challenges that individual and their family faces while they're trying to wrestle with a debilitating problem that we can't address currently. And that's just the beginning. I mean, the reality is if we continue to see more cases, more hospital beds consumed by COVID, it won't be those kinds of cases that we're wrestling with. It'll be the motor vehicle accident. It'll be the stroke patient. It'll be the cancer patient who we have to delay care for because all of our resources are consumed by patients that we're currently caring for.
Yeah, I wanted to ask you about that. I mean, obviously that individual you're serving, number one. You've talked about the strain on the staff. There are other challenges that hospitals like yours and the system at large are dealing with here economically. Talk about those too, Corey, in addition to everything else that you've already stated.
Yeah, I mean, obviously our economic challenges are secondary to what we're trying to do to make sure we're in a position to take care of patients. But certainly post-pandemic, the recovery for Nebraska's healthcare providers, and I think it's important to think about this not only from the standpoint of health systems, which might have a little bit of an easier time recovering, but think about most doctors' offices, dental offices, you name it, physical therapy clinics are largely small businesses. And when they're unable to provide care or patients are staying away because they're just not confident coming in, the economic consequences for those small enterprises are significant. They're critical for us, and I don't want to downplay the economic challenges that we've had to encounter, that we've encountered as a result of making investments in facilities, equipment, new roles that we wouldn't have otherwise not had in place. Some of that's been reimbursed through the CARES Act funding that we've received from the federal or state government, and so I've been appreciative of that, just as every other health system has. But long term, post-pandemic, every health system is going to be faced with challenges around ensuring that they have the right economic security to be able to continue to make available the services that everyone expects us to be able to without additional help.
Okay, Corey, thank you. We have less than 1 minute remaining. Final thoughts that you want to get out to our viewers?
So, I'm a native Nebraskan, and the one thing I always have known about us is I grew up in a small town. We're neighbors, and whenever a neighbor needs help, whether that's working as a volunteer fireman or, cleaning up after a tornado, God forbid, or a flood, or helping a farmer put away his or her farm harvest after something's happened to them, we always step up. And I think right now we're in that minute or moment where we're all neighbors. And we all need to do the things that are necessary in order to preserve sort of the integrity of our health systems. And that's, wearing a mask, whether you're indoors or outdoors, avoiding gatherings, doing everything you can to stay close at home, and just doing the best thing we can do to minimize the spread of the virus. Nothing's perfect, but without any effort, we're going to be challenged.
Corey Shaw, Nebraska Medicine, thank you so much for joining us today. And I want to thank, of course, all of our students who are working so hard behind the scenes, and of course, to all of you for watching. As we close, a look at scenes from Hummel Park in Omaha, seen through the lens of Lewis Kirk, a sophomore at UNO. We'll see you next week.
Consider This is an issues and information program produced by UNO Television. More information and program archives can be found at netnebraska.org/considerthis. If you'd like to share your comments about this program, call UNO Television at 402-554-2516 during regular business hours, or send an email to cwyatt@unomaha.edu.
Coming up in 5, 4, 3, 2, 1. Faded press to a full.
The University of Nebraska at Omaha's bookstore is home to more than books. The UNO bookstore accommodates all students' needs with phone and laptop repairs at the iFix UNO station or free residence hall delivery. The bookstore, located in the Malabale Student Center, is full of Maverick merchandise. Find sweatshirts for chilly Nebraska days or cozy UNO mugs for every coffee fix. Shop anytime at unobookstore.com.